Hello, everybody. How are you today? Thanks for joining me. Whether you are in the Zoom meeting or if you are on YouTube, thanks for coming. My name's Colin. I'm one of the teachers and OET experts at E2 Language. Somebody's asked a question. Is writing the same for nurses and doctors? Basically, no. You're given different tasks, but the principles apply. They're the same. So if you are not a doctor, if you're a physio or an OT or a dentist or a nurse, and you did today's class, you would be fine. The principles of what you're doing are the same, but you are given profession-specific tasks in the speaking and in the writing. Okay, so if you're an OT, you have OT work. If you're a physio, you have physio work, and so on. Okay, but for medicine broadly, if you sign up for OET writing for medicine, then you get one task. Fair enough. Anyway, so thank you for joining me. Pleasure to have you on board. Let's just get a few parish notices out of the way first. The first and most important is during this difficult time, where I think probably quite a few of you are actively involved, we're extending access to all of our packages from 6 to 12 months, and we're offering a voucher code this month of Stay Home 15. Stay Home 15, an allusion, of course, to the lockdown most of us are living under at the moment. $15 off the package of your choice. For those of you in the Zoom meeting, if you could limit your comments to the chat rather than the Q&A box, that would be great. And YouTube, I can see your comments in the comments section, so carry on. We offer at E2 Language writing feedback in a day or two after submitting your work. You'll get a comprehensive score report based on what you have written, which is, we put out for doctors and nurses really high quality case notes for you to work off. And it's very helpful for now because of need, but in general because of the way that E2 Language clients generally work. You're working on your own a lot of the time or all of the time. And so we're here to help facilitate that, make it a bit easier. That said, we also offer the one-on-one tutorials through Zoom like this, except we can see each other, talk to each other, very productive use of your time, and you'll get a great deal out of it. These one-on-one tutorials are 45 minutes in length, and they focus on one or two areas of the OET that are of particular interest or concern for you, whether it's reading, writing, listening or speaking, you choose. And the last thing I'll tell you about is the mini mock test. Mini mock test is done entirely through the E2 Language platform. And there is also a speaking role play, a piece of writing, and all of the reading and all of the listening that you have come to know and love. Okay, so that's how it rolls. Now let's go on to today's class. In today's class, we'll test your English with a little quiz. We will learn a method completing the writing task. We'll analyze that task. We will choose from the relevant case notes. We'll plan out your writing. We will then do the start of the letter according to a fairly standard form. Today we're focusing just on the secondary issue paragraph. We don't have enough time in the live class to do the whole letter. We'll just focus on that one particular paragraph today. We'll look at a model letter, we'll check out the criteria, and then we will complete the whole thing with another little quiz. So have a pen and paper handy. As you will on the day of the test, you'll have the scratch paper, the scrap paper to make your notes. And we're going to do a quiz in a moment, but before we do that, let's review the most important verb tenses in the English language. There are 12 in total. We do use all of them. There aren't redundant verb tenses in English as there are in some other languages. I'm not diminishing your languages, it's just language is dynamic, and sometimes there's a verb tense which may have been useful in 1743, but we no longer need it. That's not the case in English. What you see here, all 12 are used, but the 5 at the top are the most common. For example, the present simple. Mr. Lin urgently requires your expert assistance. The present continuous. Ms. Adams is currently receiving the present perfect. Ms. Smith has been treated with cold compression therapy. The present perfect continuous. Mrs. Tran has been undertaking the past simple. Mr. Jones was admitted to St. Andrews 2 weeks after his operation. So let's now do a little quiz. As soon as it appears on the screen, you will see that you've got a gap in each case. You have multiple options in each case, and choose the most appropriate answer. You have about a minute to do this. See you soon. Okay, thank you very much. For those of you who shared your answers, let's see how you did. The nurse admitted that she had never seen such an aggressive case of shingles in someone so young. Number 2, not for the first time we have been forced to reschedule the date of this operation. I love that inversion there. Not for the first time we have been forced. Number 3, we underestimated how much of an impact the antiretrovirals would have on her autoimmune system. And number 4, could you put your shoulders here, lift your arms above your head, then be sure to lie still until I finish the scan. There you have it. Cool, let's take an overview now of the writing. The writing test requires you to read and analyze the task, to read and analyze the case notes, and to write a letter of referral, of discharge, or of transfer. It's important to note that some of you may be working with some rather crappy old material from other places. I know a lot of OET stuff is shared in like WhatsApp groups and hand-me-down drop boxes and goodness knows, a ragtag bunch of complete rubbish. If you're using some of that material, just be very careful because some of it is detrimentally awful. So if you are not looking at letters of referral, discharge, or transfer, throw it in the bin. It's not relevant for you. All right. And anyway, just in general, be careful of substandard other material out there. The 45 minutes you have for the writing task is divided into 2 distinct segments. The reading time of 5 minutes and the writing time of 40 minutes. It's important to emphasize, and I do this every week and I will emphasize it again, you should treat the first 5 minutes as if it were, which is what it is, reading comprehension time. You are reading the case notes to ask some questions, draw a few conclusions by yourself. You read the task, you determine who you're going to write the letter to, what action they need to take, and then you read the case notes to understand the key facts of the patient's condition. You'll see that there are headings and subheadings which are there to guide you. Just because there is a subheading or a heading doesn't necessarily mean you need to use it. And then you need to identify relevant information and work out if it is highly relevant or even quite relevant. If it's relevant at all, then it will go in the letter. Then you've got 40 minutes of writing time. And in that writing time, you will plan out your 3, 4, or 5 short paragraphs. I often find when I'm writing that I write 4 or 5 paragraphs. It's not standard. It's not like, oh, it's got to be this many paragraphs. You've got to be flexible. I'm going to emphasize that again in a moment. But 3, 4, or 5 paragraphs, you decide how many there will be, and then you write carefully. There's an overriding theme or overriding idea in each paragraph. Today, we're just focusing, as I said before, on the secondary issues paragraph. So we'll start then with the 5 minutes of reading time. When you read, you analyze the task, work out who you're writing the letter to, what action that person needs to take, what key information that person requires to do their job properly, what prior knowledge that person has of the patient you're writing about. You'll then look at the case notes and work out what is relevant, what's repeated and relevant, and what is not relevant at all. So here is the task. I'd like you now to answer these 4 questions. Who am I writing this letter to? What action do I want the reader of this letter to take? What does the reader of this letter need to know? And what does the reader of this letter already know? A minute to answer those questions, and by all means, share your thoughts with me. Sweet. And again, thank you for your thoughts. Much appreciated. Quite a letter with many visits and case notes. Good question. Somebody's asked a question which I'll post to the group briefly and briefly answer it. What happens if there are multiple visits in a case? You have to condense the information. You decide, for example, if every one of those visits is relevant. If they are relevant, then you'll find a way of deciding how to order it so that, for example, there's a logical chronology or a logical evolution to the patient. You could say something like, over the past 3 months, Mr. Smith has visited our clinic on several occasions, first presenting on the with blah, 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 blah. Okay, something like that. It's up to you. Okay, so let's have a look here. Who am I writing this letter to? Gynecologist, Dr. Angela Melrose. What action do I want Angela to take? Further investigation and definitive diagnosis. What does the reader need to know? Gynecological history, current situation and condition. And what does the reader already know? Well, no prior knowledge. That's not unusual in this kind of letter of referral. Cool. Now we're going to look at all of the case notes. We're going to decide what is relevant, what's repeated, but also relevant, and what is not relevant at all. To be clear, why we make a distinction between relevance and repeated and relevant. How many times do I need to know that a patient has, I don't know, broken her kneecap? How many times do I need to know that the patient is hypertensive? So it's possibly relevant. If it is relevant and it's repeated, make a distinction between that which is just relevant on its own, a standalone fact. Anyway, before we actually do that organizing, check out the criteria. The content, to get top marks, key information has been included and nothing important is being left out. And for conciseness and clarity, you're not including irrelevant information. Okay, so that's the way you need to treat these case notes. It's your determination. I know there's lots of doctors here today, and I'm always happy to have these conversations with you about, well, why did you include this and why did you include that? When you see my organization of the case notes, no doubt, it happens almost every week, some of you will say, hang on a second, you didn't include this, or hang on a second, why did you include that? My feeling about this is, here comes the reading comprehension side of things. I've read it and understood that this is relevant, so I'm going to include it. Live with your decisions. This is not a test of your ability to be the best doctor in the world. This is your ability to read and understand case notes and make decisions on the basis of that. Okay? Psychiatrist case notes have much information about patient's surgical issue and less about depression. Well, if you think it's relevant, the surgical issue, then you will include that. If you can only determine for yourself, because you might not, this is to a gynecologist, you may have no knowledge at all about OBGYN. Doesn't matter. You don't need to have medical knowledge. That's not the important thing. The great thing about the OET is that the themes are familiar, but so it's not like the IELTS where you write about frogs and wheat and 3D printing. Here you're actually writing about things which are professionally relevant, but that doesn't mean that you're suddenly expected to be an omniscient medical brain. Understand? Anyway, here are the case notes. All of them. You've now got 5 minutes to sort those out, and a special prize for the person who can tell me that the patient's name is it's made me smile because it's a famous person's name. Not that this is her case exactly, but the name is familiar to me. 5 minutes to organize these case notes between what is relevant, what's repeated, but also relevant, and what is not relevant at all. I will be back in 5 minutes. Lovely. Okay. Thank you for those of you who shared your observations. It's not compulsory. No, not Helen Keller. No. Helen Fielding is an author. She's a very famous author, journalist and author. She wrote Bridget Jones. Anyway, this isn't no case notes. So let's have a look what's relevant. All in red there. We have the name, date of birth, a little bit of past medical history there. Pretty much everything as far as discussion from the third of the first goes. OE notes and management plan. So what's repeated in blue? We fill in the rest of the management plan, the rest of the discussion, and a little bit more on current meds and a bit on the social background there. This would be a very good time to take a screenshot, because what I'd like you to do is compare these organized notes with the letter that I'll share with you in a little bit as well. If there's anything there that's causes you anxiety or confusion, let me know. Otherwise, I'm perfectly happy to move on once you've taken your screenshot and show you how we will craft that into literary gold. Okay? All right, then. Let's move on. The 40 minutes of writing time. Be flexible. I do say this every week, and I do emphasize this. You have to be flexible when you write in the OET. For those of you who have come from the IELTS especially, you may have come in with a very different approach to writing, such as would not be employed or encouraged in the OET, and that is a degree of inflexibility or a certain amount of preconception of what constitutes best practice as far as writing is concerned. It's not the case with the OET, it's a different kettle of fish. So please be flexible. Don't go in and say, it's got to be 3 paragraphs. It's got to be like this. I have to start with this and then I have to go to that. Different approaches can all be successful. So please be flexible. Little reminder also of the voucher code, Stay Home 15 gets you $15 off our extended access packages because of the corona crisis. And we get back to the writing structure. Well, we're only focusing on the secondary issue today in this letter, which I think is 4 or 5 paragraphs in total. But let's first talk about the planning and writing before we get to the secondary issue paragraph. We start with addressing the patient, for which you follow a recipient. I'm so sorry. Addressing the recipient, for which you follow an outline. We'll talk about in a moment. You then take notes and you plan. You are responsible. You decide how many paragraphs are going in your letter and what information will go into each of those paragraphs. And then when you write, you continually check the relevance and importance of what you're writing, making sure that you do leave a few minutes over at the end to check your work. That will have a positive impact. So writing the outline. This is how it goes. You start at the top with the title and the full name of the recipient. And then the job title of that person, then their full address, and then the date. The date should be the date of the test. Don't start fiddling about and saying, oh, it's got to be this, that, or the other. Don't worry. It's just the date of the test will be fine. Good question, Valentina. I'll tell you that in a moment. Then the reference line, patient's title, their full name, their age, and their date of birth. And then the salutation, dear Mr., Mrs., Ms., Doctor, and their family name. And then you go through the letter and then you sign off yours faithfully if you don't know the name of the person. So if you start the letter, dear sir, madam, or to whom it may concern, you'd end yours faithfully. If you do know their name, dear Dr. Smith, yours sincerely, and then just write the word doctor. All the information is there on the left-hand side. You've got 90 seconds to organize the letter outline. Okay, thank you very much. So here he goes. Dr. Angela Melrose, gynecologist, Portsmouth Hospital, Portsmouth, then the date, 030119. I generally prefer the 8 number date. It doesn't really matter though. Then we have the salutation, dear Dr. Melrose, then the reference line, re, Mrs. Helen Fielding, date of birth, 15/11/1981, then the letter, and then yours sincerely. If the date goes at the top, that's fine. If the date goes under Portsmouth, that's fine. If the salutation goes above the reference line, that's fine. And if the reference line goes above the salutation, that's fine too. Don't sweat the small stuff. Just make sure you've got everything in there, all of the elements that you need in order to get the job done. Okay, nice. So let's move on and look at the guts of the letter. That's the 180 to 200 words that are so very important in achieving the task. Planning and checking the case notes. Excuse me, don't know why it's now frozen up. Hold on a minute. You decide how many paragraphs are going into the letter, and you will decide what information will go into each paragraph. Now today, we're only focused on the secondary issue paragraph. So what does that mean? The main issue has been covered. What are the other issues to cover? Okay, so that's what you're going to be looking at in the case notes. Now, 90 seconds, secondary issue, the main issue has been covered. So what are the other issues to cover? Find that, please, in 90 seconds. See you in a minute and a half. Okay, thank you. Let's have a look then. This is what I've got. Thank you, by the way, for those who did share yours. Really appreciate that. And I love it when you include little question marks, because it's like, maybe? Let's see. I don't know why it's lagging a little bit. Just hold on a moment. Just bear with me. Just one sec. Okay, there it is. So secondary issue notes that I've got are as follows. The discussion uses pads and tampons, 6 to 7 days, frequent changing, nil intermenstrual or postcoital bleeding, passing large class management plan, iron supplement, Floridix before meals, stop aspirin intake, change to Panadol for pain relief. So with those planning notes, useful language that you may want to employ includes words like which require, typically, has been advised, and for this reason, and replace. There is the information you require. You now have 5 minutes to convert that into a nice coherent paragraph. I'll see you in 5 minutes. Okay, thank you. So, and thank you very much to those of you who've shared your notes. Good. All right, nice work. Let's have a look then. Mrs. Fielding's menstruation typically lasts 6 to 7 days, and she uses both tampons and sanitary pads, which require frequent changing. Although she has not experienced any intermenstrual or postcoital bleeding, she has passed large clots of blood. For this reason, she has been advised to take Floridix iron supplements to help raise iron levels and replace aspirin with Panadol. Here is the entire letter. You may now want to take a screenshot of that. Like I said before, you've got the case notes organized, and now you've got the actual letter. You'll notice there is no hard and fast rule about how long a paragraph should be. Some of them are quite small. In this case, the introduction and the request are quite small. I looked at a letter recently in a live class where the request paragraph was nearly 4 lines in length. So don't go in with preconceived ideas. Be flexible, be open-minded about the way that you approach it. The other thing that you can do after this class, when you've got the screenshot, is think about the way that the paragraphs are structured. Okay, I think you're going to find it a very useful exercise. Okay, so there you have it. Let's go back to the criteria, language specifically, and more specifically than that, cohesive devices. Very, very important element of grammar that need to be used accurately, and they have to assist in the overall meaning. A screenshot for you right now about conjunctions, starting with what we call the fanboys at the top, or, and, nor, but, or, yet, so, fanboys, and then the other more common conjunctions, and then some of varying degrees of, let's say, common use, and some more rare. But even so, the appropriate use of these cohesive devices will reflect very well on your overall efforts. Look at the example here. Dr. Smith, who has been practicing for over 40 years, is both up to date and open to some of the more radical therapies. So there you have an example of the appropriate use of cohesive devices. There was in that sentence a relative clause. Relative clauses are clauses which use relative pronouns like who, which, that, where, whose, and whom. Let's look at some examples of those. St. Thomas's, which is the biggest hospital in the city, is seriously understaffed. Dr. Spivey, whose work on Lyme disease has been widely published, will be giving a talk this evening. The accident and emergency department, where our patients are triaged, is in dire need of extra seating. Now, if we look here, we have an example of where we take multiple sentences about a subject, in this case, Mrs. Hamer, and we condense it to make it into a nice, cohesive, coherent sentence. Mrs. Hamer felt weak. Mrs. Hamer's blood pressure dropped suddenly. Mrs. Hamer sat down. Mrs. Hamer put her head between her legs. Putting her head between her legs made Mrs. Hamer feel better after 15 minutes. So it's a happy story. Let's make that, however, into something much more, let's say, linguistically sophisticated. Mrs. Hamer, who was suffering from weakness as a result of sudden onset low blood pressure, remedied the problem by sitting with her head between her legs for 15 minutes, and then she felt better. Okay? That's what we mean by the appropriate use of cohesive devices. So now you've got your last little quiz, and that is rewriting these little groups of sentences. The first, of course, about PTSD. Take 2 minutes to do this. Use appropriate cohesive devices to make these into single sentences. Okay? Lovely, thank you very much, and thanks for your suggestions. Let's have a look, see what the answers are. Generally, of course, there is more than one way to skin these cats, but let's have a look here. We've done relative clauses for all, non-defining relative clauses using which, the relative pronoun which. PTSD, which is prevalent among ex-servicemen, should be treated with medication and therapy. His heartburn, which was worse after meals containing wheat, was alleviated with OTC medication. And Mary's rash, which got itchy every time she went swimming, was very painful. Okay, nice. For more information, don't forget to go to our wonderful platform, e2language.com, click on your, well, once you've logged in, go to your dashboard, click on the OET course, and you'll see all of the material that we have available within the platform for you. Also, don't forget about the official OET website for up-to-date information about test centers and dates and so on. I know there's been a lot of chopping and changing recently because of the COVID-19 situation. For your reading, I think Science Daily is probably one of the best things you can do. For listening, well, podcasts on a regular basis, different countries, different podcasts, but quality-wise, the ABC in Australia, CBC in Canada, BBC in the UK, and NPR in the United States. In the meantime, don't forget we've got the offer code and extended Stay Home 15. Stay Home 15 gets you $15, the package of your choice, and we do have those mini mock tests available to do for those of you who have not yet done the test and you're thinking that you maybe would be time to do one. That's a good opportunity to practice. This has been OET Writing for Medicine from E2 Language. My name has been and remains Colin. Thank you so much for your company. Why is today's day not used, Ebenezer? Because this was written a little while ago, that's all. That's the only reason. Yes, if you have any questions about the writing or perhaps any other part of the test, I'll happily answer those. Otherwise, listen, enjoy the rest of your day. If you're about to go to bed because you're on that side of the world, sleep well. And if you are on my side of the world, stay at home, I guess, as we do now all the time. Okay, nice. Listen, thanks everyone. It's been a pleasure. If there are no specific questions, I shall move on with my day too. All the best. Good luck with your preparations. Cheers. Bye-bye.